backup she requires, we will move the staff here and create a bigger setup. Money is required, that's okay, but we'll at least give the space so that, for women, men, it's a privacy aspects also there. So we'll do it, and it's very important because the time we will go through the menu, actually the list, like right from Shirodhara onwards to other things like dealing with digestion and digestive issues and problems, and overall wellness, well-being. So these things are very important, and these things are going on for centuries together, and there is nothing, it is a tried and tested. Whether it's a Panchakarma, and priority will be given by the government. I have told them now to give her additional staff, also whatever staff and consultants, so that this center will be concentrating only on two, north and south for now. I don't just want to feed one consultant everywhere, that doesn't make any sense. These two centers are going to be important.
So during your earlier visit, you have said you are going to sort out that staff shortage issue from the
Staff
side.
shortage is not yet sorted out. I made a statement yesterday. I don't think you read it. I just now also made a statement. It is important, along with staff shortage, what we are going to do. 3 center of excellence is a must, without which we cannot do justice to the people of South. So I am on it. I am on it means I am seriously on it on a very different mode, and we will sort it out. Centers and all, she was in that other hospital, and now we have taken it up as a challenge to put the PNRC in order.
Yes, sir.
Frazel Araujo put as a nodal officer along with Dr. Medni, all of them are there, and they started. It's not easy. The child is born. It's important that somebody is well trained to actually find out if there's any kind of anomaly in the. What do you call it? I'm coming there to the.
So as far as South Goa district, what can we see?
So yeah.
What work can we see happening?
District hospital is the center of excellence. Staff shortage is there, but we will overcome it. At the same time, you require orthopedics, you require for dealing with emergencies, you don't want the patients to be shifted from here to JMC. Cardiac, angiography, angioplasty is a must. And then in addition, the nursing college, I have taken a decision that on nursing college will be shifted, started on the book. When you talk of private medical colleges, all these things you have to follow codal formularies without which I will not be moving 1 inch. And most important is that nurses are required. Honorable Prime Minister has with his vision, has increased the number of seats all across the country, which you all have seen in the budget, which will give us additional doctors. So they have also suggested that Goa Medical College increases the number of seats. So all this infrastructure work is heavy duty work, and neurology. These 3 streams are required in this hospital. Then we can say we have done some justice to people of South. Otherwise, what is the point? You understand what I'm saying? ICU also, more interventions are required. Multiple things are there. It's not simple. And I'm on it. I know that before the end of this term, I will put it on track. I'm not new. I know my work. But sometimes there are hiccups. Sometimes there are obstacles which you come across. There are certain times you don't get the type of staff that is there. Type of technical and doctors. It's very important for us to find. We're creating that environment and ecosystem. We'll do it.